Right now, we are talking about the Santa Cabrini Hospital situation. Of course, the back and forth that dominated the news headlines last week about whether Québec's Office québécois de la langue française was actually sending an inspection team in to Santa Cabrini. This is the hospital that was founded primarily to serve the Italian community here in the Montreal region. Was it an inspection? They said that, no, we were not sending inspectors, but then it did turn out that they sent people, they just didn't call them inspectors. To help sort this out for us, we welcome the Gazette's health reporter, Aaron Derfel, who's been on this story from the beginning. Aaron, great to talk to you again.
Good afternoon, Trudy.
All right. So the OQLF seemed to have been splitting hairs in the views of many Montrealers last week by saying, no, we're not sending inspectors to the hospital, and then having to backtrack on that, but use another expression. Give us the background.
Yeah. So they initially, the OQLF denied sending anyone, but then when pressed, a spokesperson said that they sent a francization advisor, not an inspector. And the francization advisor's job is not to inspect, but to, in their words, accompany usually a business in its efforts to make more of its business French. These would be companies that have at least 25 employees. And then once they go through that process, they're certified. To date, as far as I know, this is something that's only been applied to the business sector, but they're now sending these francization advisors to hospitals. As far as the visit is concerned, to Santa Cabrini, they went to look at the unoccupied operating rooms to check whether some of the American-made medical equipment, whether it was in French, whether some of the instruction manuals were in French. They also spoke with the heads of several departments. So it kind of, you're splitting hairs, as you said. It's just semantics, whether it was an inspection or a verification, or a visit. I think it's a distinction that's lost. That was certainly lost on the workers at Santa Cabrini who felt there was an inspection.
And also lost on the general public among Anglophones who, are rolling their eyes once again and asking, why is the government doing this? Are there not enough problems in the healthcare system to be focusing bureaucratic attention on? Has there been any reaction, Aaron, from anyone in the Legault government to this concern from the Anglophone community about what went on at Santa Cabrini?
Well, there's been, thundering silence. The government is not in session, and perhaps that's to the government's advantage. So you've had Liberal members of Parliament at the federal level, and you've had Gregory Kelly, an MNA for, I think, Jacques Cartier riding provincially, who are urging a meeting with the Premier to clarify these rules, because there's this directive as well that seems to those in the Anglophone community who have studied it say that it basically, even for bilingual institutions, now says that English could be spoken in a hospital or any healthcare facility only in rare exceptions like life and death emergencies. So that really concerns them. A lot of this arises, or all of it really, following the adoption of Bill 96, which was the Coalition Avenir Québec government's overhaul of the French language charter, and that those changes, amendments, they expanded the requirement to speak French in all sectors of Quebec society and government and healthcare. So that's what's happening. We're seeing the follow up of this. That's why the Health Ministry on July 18th drafted this language directive that critics are saying is at the very least confusing and overreach and potentially dangerous.
Well, it does. It does, bring to mind this whole notion that if you were a historic Quebec Anglo, you wouldn't have to jump through too many hoops to ensure that you got service in the language that you chose. But now the indications are that you will be subject to certain conditions, and only if those conditions are met would you get. That's the implication I've seen, but some interpreting those that it's only going to be maybe in emergency situations where you will automatically be treated with English.
Yes, precisely. So that's the concern, and there has to be some clarification about this. But even on this issue of historic Anglophones, and even let's take Santa Cabrini as an example. In 2014, it was listed under Section 29.1 of the French Language Charter, meaning it could use that the staff and patients could use language, in this case Italian, a language other than French. But if you go on the website of the OQLF, the Office Québécois de langue française, look at it on its website today. Santa Cabrini is no longer on that list, Section 29.1. So there's some confusion because under the Health Ministry's website, it has a hyperlink to services that are offered to the Anglophone community and to ethno-cultural communities, and on this, Santa Cabrini is included. So, but, it would appear that the OQLF list takes precedence. So there's a lot of stuff that's up in the air that's unresolved. And, in the meantime, what's odd about this is that a study that the OQLF released in April shows the use of English in decline on the island of Montreal when it comes to healthcare, and the use of French rising. And this was even before the adoption of Bill 96 2 years ago.
Aaron, can you tell us, you have your finger on this health beat up and down for the Montreal Gazette. Can you give us any type of a hint about maybe some avenues of inquiry that you're going to be pursuing in the coming weeks and months on this file?
Well, I'm looking into other institutions that have been visited. I'm not going to scoop myself live on air, but I'm looking at that, and then there's something that the Gazette will be looking into is medical outcomes, because there's a whole body of research around the world that's touched on this issue when there are miscommunications that can lead to bad medical outcomes. And so you're seeing that happening more, and there are cases, more and more anecdotes of Quebecers, English speakers, who say that if they weren't outright denied service in English, that there were miscommunications that resulted in perhaps medical complications. So, this is just a serious issue. And you recall, even Bill 96, the Legault government had to invoke the notwithstanding clause to adopt it, because it otherwise would have, violated the Canadian Constitution. So, these are serious issues. We're talking about language rights. We're talking about really human rights and healthcare. And it's one thing to perhaps regulate a business, but now we're entering the realm of healthcare, and it's really struck a chord with our readers, and probably many of your listeners, that there's something that's changed, and it's changed as a result of the CAC government's adoption of Bill 96.
Yeah, I think you're absolutely right about that. Aaron Derfel, thanks very much for your time.
My pleasure.